Hello, today we are going to discuss myths and facts about obesity surgery or weight loss surgery or bariatric surgery. The commonest myth about weight loss surgery or obesity surgery is that it is nothing but liposuction. No, friends, in liposuction we just remove fat which is below the skin, which is called as subcutaneous fat, while in bariatric surgery we do not remove any fat. So liposuction is basically done to make somebody cosmetically beautiful, while bariatric surgery is something which is done to make somebody healthy, because after bariatric surgery different diseases like diabetes, blood pressure, obstructive sleep apnea, polycystic ovarian disease, joint pain, reflux disease, heart disease, all these diseases are either cured, get reversed, or they get better. Because problem of all these diseases is excess weight. After bariatric surgery, your weight gets reduced, and that is how you become healthy. The second commonest myth about bariatric surgery is that bariatric surgery cures diabetes. Well, it's partially true. Diabetes is of two types. One, which is called as type 1 diabetes. Now, this diabetes is because your body is not able to produce insulin. While second, where your body is able to normally produce insulin, but because of excess fat, the insulin is not able to work effectively. This is called as peripheral insulin resistance. Bariatric surgery causes fat loss and weight loss, because of which the peripheral insulin resistance decreases. Now that is why diabetes in obese people can be completely reversed, and we have good number of patients who have gone off diabetic medications like tablets, injections of insulin, and are living a healthy life without any anti-diabetic drugs. Whereas patients who are type 1 diabetes and having not able to produce endogenous insulin, the utility of diabetes surgery or bariatric surgery in them is only for the purpose of weight loss and not for the purpose of diabetes reversal. Now, one of the common myths about bariatric surgery is that it is an irreversible surgery. No, this is not true. In fact, surgery of gastric bypass is surgery which can be completely reversed. So in future, at any given time, if you feel like going back to your original anatomy the way you were, that's very much possible. Endoscopic gastric balloon is a procedure which is done very routinely in young women who want to get married and lose some 15 to 20 kgs, and is a completely reversible procedure. You put an endoscopic balloon by means of an endoscopy, which is a daycare procedure, and 3 months, 6 months down the line, when you have adequate weight loss, you can take out the balloon again as a daycare procedure. People feel that once they get bariatric surgery, their job is done and they are free to live the way they are living. Friends, we have to understand that whatever weight we have gained, which is an excess weight or which is a morbid obesity, is basically because of indisciplined lifestyle. Now, if you want to get operated for bariatric surgery and then don't follow discipline, trust me, you are heading towards again going back to where you were. I have not seen a single patient who has not lost weight after bariatric surgery. But yes, I have seen few patients who have been non-compliant, indisciplined, and they gaining their weight despite they undergoing bariatric surgery. So bariatric surgery does cause weight loss, but diet and exercise discipline after the surgery is something which probably we were not able to do because of our excess weight, which we should be doing after the bariatric surgery. Now, cost is a bigger concern with lot of people, and they keep on asking us, whether this surgery is covered in insurance. Yes, now bariatric surgery is covered in insurance. You ask your insurance agent whether the insurance gives cover for bariatric surgery. Not only that, your central government CGHS, CSMA also gives compensation for bariatric surgery. And besides that, if there is somebody who is obese and having diabetes and other medical diseases, you imagine your monthly expenditure must be at least to the tune of 10 to 15,000 rupees on drugs. So your yearly expenditure will be somewhere around a lakh to 1.5 lakh anyways. So you will be able to recover your cost of bariatric surgery in 2 years time, because after bariatric surgery your medical cost will go down significantly. And yes, I am not considering the cost of your hospitalization when you have sickness. So it's a choice whether you want to live with wellness or you want to live with sickness. Well, and there are enough institutions which give finance for getting operated for bariatric surgery. So you can just pay 1/3 of the cost of bariatric surgery and get interest-free EMI to get your weight shed off and start a new healthy life. I hope I have cleared enough myths about bariatric surgery, and this video will give enough knowledge to all of you about what is right when it comes to science of weight loss. Thank you so much.